The Jets are back at halftime. 59-56, Wizards on top of the Miami Heat. It is the Carmex halftime show. And again, we have a wonderful partnership with MedStar Health. And part of that is, we want to stay healthy, help you stay healthy in so many ways. This is Heart Health Month. It's Valentine's Day coming up. Dr. Waqas Haider is from MedStar Health, and we begin the conversation with Dr. Haider just about, some of the risks. Know your risks for heart disease.
And some of the important ones include a history of diabetes, high blood pressure, high cholesterol, history of tobacco smoking, and a sedentary lifestyle. And now, as we are doing more and more research, we find that a genetic predisposition, so somebody in your family who's had heart disease, your father, brothers, that also means that you may also you may be predisposed genetically to heart disease as well. So those are, some risk factors that can certainly elevate your risk of having blocked arteries and heart attack.
And of course, we want to avoid that. And remember, the heart is a muscle. We can make it stronger, healthier, and you don't have to run a marathon.
That is such an important point, Dave, there can really be a spectrum. So what's exercise for you may be different for me, may be different for an athlete. So what we really recommend as part of the American Heart Association guidelines is trying to aim for at least 150 minutes of moderate intensity aerobic exercise per week. And you can really break those 150 minutes, based on individualized exercise sessions. But what I want to pick up on, something important that you mentioned, is it doesn't really have to be a marathon. It could be something as light an exertion as a walk, because even that can be difficult for some folks based on, how functional they are, based on what their body habitus is, and basically what they're used to. And for others, it could mean being on the treadmill for 45 minutes a day. And sometimes I have this chat with patients who are very athletic, and I talk about exercise, and they tell me, well, I'm already doing all of those. And we basically say, well, you reinforce that. But, it could certainly mean light walking to brisk walking. It could be swimming, anything that can get their heart rate up, but accumulated 150 minutes per week.
Yeah, you heard Dr. Haider right. That's 150 minutes, not a day, for a week. 7 days. Do the math. You could accomplish that. And speaking of numbers, you should know your numbers. I think of that the big three. Cholesterol, LDL should be lower than 100, and lower the better. Blood pressure, 120 over 80, and the blood sugar less than 7%. Is that a fair assessment? Those are the big three numbers to really focus on?
That is an absolutely fair assessment. We tend to be more aggressive with those numbers, and I would not go into the nitty gritty of those, because those numbers need to be much more optimal for patients who've already had heart disease. But for the general population, that is an absolutely fair comment with regard to the thresholds of those three, the big threes that you mentioned. Two more things I'll also like to, that's sort of going into a slightly different tangent, but still within the realm of risk factors, as tobacco use. So, we cannot stratify tobacco use, smoking cigarettes or cigar or any other family of tobacco use. Just the mere fact that someone is smoking cigarettes can be a very important, potent risk factors, not just for heart disease. It could be many different organs that are affected, but certainly as cardiologists, we worry about alcohol use, or tobacco use, and same for alcohol use. It's, heavy alcohol use, or, frequent alcohol, binge drinking, so to speak, can also elevate your risk of heart failure or other rhythm disturbances. So in addition to the big threes where numbers are concerned, some risk factors or some lifestyle changes to be made would be to do with tobacco use and alcohol use as well.
And Dr. Haider also says no to e-cigarettes or vaping is also a good idea. We appreciate Dr. Waqas Haider for his time as, let's be healthy. And again, just think about that. To help keep your heart healthy, he's saying 150 minutes a week of walking. Get up, move. And remember, you can take us along on Washington Wizards Radio. Again, we thank MedStar Health for the wonderful support. We're going to keep you healthy. That's how they treat you. That's how they treat people. MedStar Health. 59-56, Wizards on top of the Miami Heat. More in a moment on the Washington Wizards Radio Network.